What if your doctor told you, if only we had found out sooner, your outcome would have been better? Today I'll persuade you to begin performing breast self-exams. I've been a nurse for 10 years and I've managed the care of those diagnosed with breast cancer and also those receiving treatment for breast cancer. I've had family members and friends who have been diagnosed with breast cancer, and by having early detection of this breast cancer, their outcomes and life expectancies have been increased because of that, and most of their cancers have been placed in remission due to their treatments being proactively. Today I'll persuade you to begin performing breast self-exams. First off, we're going to look at why we should be doing those breast self-exams, what puts you at an increased risk for breast cancer, and how to perform a breast self-exam. We will now look at breast self-exams, and we're going to look at our first of 3 points. The first point is, why should we be doing these breast self-exams? Well, first off, it's really just to get to know your body. That's the first way we're going to detect that we have something going on with our bodies, and that's by knowing it. According to Taroni, they want us to recognize our normal appearance. What is the things to look at whenever we have a visual change, such as a change in our breast shape, form, dimpling, anything that would be symptomatic. Those are the things that we want to report to our physicians. And of course, our breast cancer awareness goal is to report changes to your doctor. So it's very important, okay? The second thing we're going to look at under this category is looking for their signs and symptoms. Obviously, those were the lumps, any changes in those breasts, obviously any discharge that would be not related to breastfeeding. Those would be the things we have. According to Block and Morello, for males, mostly it's a subareolar mass that is palpable with males. And sometimes those are actually in place, and the symptoms are there for almost 6 months before males usually actually detect it. One of the other things that we look at as far as breast self-exams is they don't cost anything. They're free. These are things you can do in your own home by yourself with not anybody else being a participant in it. A study by Bryan and Associates stated that poverty, less education, and a lack of health insurance is all associated with lower cancer risk survival rates. So just by doing these at home, it gives you a chance to really know what's going on with your body, so you can achieve that breast cancer awareness goal, report changes to your doctor. Our second point we're going to be looking at is what puts you at an increased risk for breast cancer. A study by Ozan, Howe, Omer, and Esserman, they created that nice little tool that's online, breasthealthdecisions.org, that you and your physician can go over and kind of input things that really tell you what may put you at an increased risk. Those increased risks do include obesity, hormone therapy, family history, genetic markers, and also those in the age group of 50 to 75. And they say that some things to kind of get you out of that risk would be to increase activity and to limit alcohol intake. Our third point is going to be performing breast self-exams. So this is very interesting here. I'm going to actually show you how to do this. So I'm going to put this shirt on here. And the American Cancer Society suggests that you lay down when you do this. So, but for this purpose, I'm going to do it standing up. So you want to put your arm up over your head, and you want to start from the axillary and work to your sternum. Obviously, you can see here on my shirt it has arrows up and down. So we want to start here using your 3 fingers with different pressure points, and work your way down, back up, all the way through, down around the nipple, across the breast to the sternum area, and then that is the way to do a proper breast cancer breast self-exam. In conclusion, today I've persuaded you to perform breast self-exams. Obviously, our goal is to report any changes to your doctor. We have discussed why to perform these, what increases your chances of breast cancer, and how to perform a breast exam. And we want you to really do these exams because this is a way to be proactive and to really increase your outcomes if you were diagnosed with cancer. And some groups that are out there that really help and really raise awareness for breast cancer is Remember Betty. Team Betty is really a lot of people who are on that, and also the Susan G. Komen Foundation. They do a lot of things for breast cancer awareness and research and help those who have been diagnosed with breast cancer and treatments and just helping them out financially. I want to thank everybody. I hope everybody has learned something about breast cancer and breast self-exams. Thank you so much.
Oh, we spoke about or?